I didn't avoid the dentist because I didn't care. I avoided the dentist because I experienced dental trauma. And that trauma shaped how I handled periodontal disease for years. I'm 37 years old. I'm living with advanced periodontal disease at 37. And part of why it progressed the way that it did is because I became afraid of the dentist. The first experience, there was an appointment where the provider came in, looked in my mouth, and body language says a lot. Their eyes widened. They physically leaned their body away from me like they were trying not to be close to me. No one directly insulted me, but you don't always need words. You can feel when someone is grossed out. And when you're already vulnerable in that chair, that feeling sticks. The moment planted something in me. Shame. At another appointment, I had my gum pockets checked. I was told I would probably lose my teeth in about 7 years, maybe less. And that was pushing it. It's been 4 years. So when I say my advanced periodontal disease at 37 didn't appear overnight, I mean it. This has been progressing for a long time. During pregnancy, one of my last, there was a separate dentist that I saw while I was 7 months pregnant. They told me sternly that I needed to do a better job brushing my gum line. And I said, how? And they said, you brush them. I said, I do. I use a toddler toothbrush with soft bristles because my gums rip open. Look at them. They were like hamburger meat. They tore. They bled. They were raw. And I was told, you've got to get over it and brush them anyway. Then my gum pockets were checked. And that was excruciating. The way that it was done felt so aggressive. I was bleeding. I was saying that it hurt, and I started having contractions. I couldn't continue. I walked out of that appointment in tears, and I couldn't eat the rest of the day because it felt like knives had been shoved into my mouth. It burned. It tingled. My teeth ached so bad. That day changed something in me, and I was done with dentists. Before the pandemic, my kids were little. I didn't have sitters, and I didn't have extra money. So even without the trauma, it was hard to go. Then the pandemic happened, and time passed, and when you stack dental trauma, shame, logistics, motherhood, and fear on top of each other, avoiding the dentist felt reasonable. But avoiding care does not stop periodontal disease. It just keeps progressing, quietly, then loudly. My gums kept bleeding, my teeth started feeling loose in my 30s, and I kept telling myself it wasn't that bad. Now, at some point, I realized something. I'm not a child in that chair. I'm hiring them. They work for me. And I will not tolerate being belittled in a space where I'm seeking care, especially when you're vulnerable. If someone makes you feel small when you're trying to take care of your health, that is not your provider. That does not mean you stop seeking treatment for periodontal disease. It means you find someone better. Now, this year, I finally went back, gained the courage, and the experience was completely different. I was listened to, I was validated, and I was told clearly that my gums are not normal for my age. That even in severe neglect cases, this level of gum weakness at 37 was unusual. That there is likely a genetic or connective tissue component contributing to my advanced periodontal disease. And for the first time, I didn't feel blamed. I felt informed, validated, and that changed everything. Now, it took me a long time to prioritize myself. Motherhood, logistics, pandemic, fear, shame, all of it layered. And yes, my health suffered. But now it's time to move forward. Now it's time to plan the next step. And if you're afraid of the dentist because of dental trauma, if you've delayed care because you felt ashamed, please don't let a few bad experiences stop you from seeking help. Keep finding someone until someone finally listens. Find someone who explains things. Find someone who treats you like a human being. You deserve that. And I'm finally choosing that for myself.